Hi everyone, Dr. Nemechek here. I want to talk about something that's happening commonly and which is, I think, very poorly managed, quite honestly. And that's strokes that we have. Now, I'm not talking about acute management. I'm talking about the chronic management. Now, what we have here on the screen is a picture, MRI scan. Here is non-contrast. You can kind of see this looks a little lighter here, than the other tissues around it. And then when they do the contrast, look at that baby light up. This poor person has a right middle cerebral artery infarction, stroke, and this is the part of the brain that controls motor function. So on the right side of the brain, this person is going to have like left arm leg problems. They can't move them, paralysis. Or this person, if it's a little more forward, they're going to have left arm face speech problems, okay? And they'll go to physical therapy, 3 to 6 months, you might get some recovery back. This is a rather extensive one, so there's definitely going to be residual here. And that's kind of the typical thing. But a large number of these patients have other problems. They got brain fog, they can't remember, they're tired all the time, they're anxious, they may have chronic depression, they're constipated, they now got reflux. A bunch of other stuff happens. And everyone's like, well, you got a stroke. Those things are not in this area of the brain. Those problems are in other areas of the brain that were not affected by the stroke, the death of the cells there. Okay? And we know those other things is when you have a stroke, there is like this rippling effect through the brain of inflammation. Okay? The whole brain gets inflamed by the shock wave. And as I've talked about in my other videos, inflammation is one of the things that can damage neurons in your brain. So you basically get this inflammatory concussion through the whole brain. Now, and if you have too much inflammation, you will not recover from those. And 100% of people with a stroke have too much inflammation because it's the inflammation is what triggers the stroke in the first place, okay? So people are going to have this rippling effect. They aren't going to really recover much from that. But that is fully reversible in these patients, all right? Now let me explain. The area that's most sensitive to this inflammatory shock wave that happens after a stroke is the autonomic nervous system. This is a regulating part of the brain. It doesn't do something per se, but it makes everything work in a very coordinated fashion depending on the kind of stress you're under. Now it controls your emotions, your hormones, your immune system, your metabolism. This graphic here, it's got these two branches, and this graphic shows how it influences all the organs in the body. It influences blood pressure, heart rate, intestinal motility, bladder, everything. Now, when people have a physical concussion, like we think of like a sporting accident, the things that people complain of come out of this part of the brain. And the similar things occur when you have a inflammatory concussion, when you have this kind of injury. And you can break them down to two mechanical things, the vast majority of all these complaints. And those are, the first is people have trouble generating blood pressure into their head at the proper pressure. Okay, if here's your head, you've got to push blood into your brain at the right pressure for things to work right. Now, it's all about oxygen. You have red blood cells, you breathe, you fill them up with oxygen. That's not a problem after the stroke typically. It's pushing it at the right pressure so that flows into your neurons. Your neurons only have 1 second of spare oxygen, all right? And when this doesn't happen right, people can't think, they can't focus, poor concentration, they're tired a lot, it might make them anxious, they may crave salt and sugar, can make you kind of fidgety. And all of these kind of things, and this problem, pushing blood in your head, if this happens this is, we call it cerebral hypoperfusion. Okay? That's what they call this. So we have low blood pressure in the brain after a stroke. Okay, and here unraveling it, vascular cognitive impairment. So this is after a stroke. Okay. If this occurs in a 16-year-old, I don't mean a stroke, I mean the low pressure, can't think, can't function, okay? It's called attention deficit disorder. And here, majority of stroke patients probably have undiagnosed attention deficit disorder from this damage, which is reversible, okay? Because again, it's not where in the white areas of that stroke, it's these other areas which are, for the most part, functional. Now, another thing happens here is your intestinal tract is like a conveyor belt, okay? And each segment has to push stuff along the line, and there's a set function there. When people with strokes, what happens is this will slow down, and mainly one of the most common things they complain of is constipation. And here we go. Risk of constipation with acute or subacute strokes is almost 60%. All right? And that's because, go back to this picture, the intestinal tract isn't controlled here. It's from this secondary rippling effect that's affecting the autonomic nervous system. Okay? Now, aside from slowing down the intestinal tract, one of the problems is when this slows down, there's a condition called SIBO, where the bacteria in the colon are now living in the small intestine. You have a dramatic increase of that developing in stroke patients as well. And this is what leads to leaky gut. So now you're going to have a stroke, you have SIBO, more inflammation, worse outcome from your stroke, okay? And I always like to show papers. So here's a paper. Rapid gut dysbiosis is a different term they're using for SIBO. And here this paper is talking about how it worsens the stroke outcome, okay? Now, Nemechek protocol was designed to reverse autonomic nervous system damage. We started almost 25 years ago on this project. We got a patent for it about 12 years ago. Combination of fish oil, olive oil, vagus nerve stimulation in the ear, and we used a non-absorbable antibiotic called rifaximin that's very safe and has been used for this for 20, 30 years, actually, to get you like this. We have high levels of recovery here. I would say of our stroke patients, of their non-motor function stroke issues, most would say they're normal or near normal now in terms of the other aspects. Okay? So, if you or somebody you love had a stroke and they have all these other effects, remember, the motor part which caused the stroke is separate from the things that causes brain fog. They're different parts of the brain. They shouldn't have the brain fog and all this other stuff. They shouldn't have the bad constipation. They shouldn't have the emotional lability that's happened after this. Okay? It's not from the stroke. It's from the secondary effect, which is reversible. And typically, 6-8 months, dramatic improvement on the protocol. I mean, dramatic. So, fish oil, olive oil, vagal stimulation, get one of our books. Even though the book talks about like ADD, attention disorder, look at the doses for adults in there. Those are the doses I would give you. And then you're going to need the non-absorbable antibiotic rifaximin. That's in the book as well. And if you try to get your local doc to provide that, if you can't, you may want to come out here for a visit and we can get you set up. If you have questions about coming here, in the sections below, there's some links about the practice, phone number, and stuff like that. So that's all. Remember, a lot to be gained from strokes. Okay? It's not a bunch of fancy medicines. It's a very sophisticated way and a subtle way of just turning off the inflammation, and that allows your nervous system to recover on its own and all these other areas outside of that immediate stroke area. So that's all for today. Remember, hit subscribe so you get the rest of our videos, and I'll be talking to you again soon. Thank you.